Welcome back to CareWise Senior, your trusted source for health and wellness insights tailored for our vibrant senior community. Today, we're tackling a critical topic that often goes unnoticed: the unique and elevated stroke risk for women over 50. While stroke is a serious health concern for everyone, emerging research highlights specific factors that make postmenopausal women particularly vulnerable. We'll dive deep into why this is, what the hidden dangers are, and most importantly, what proactive steps you can take to protect yourself. This isn't just about statistics, it's about understanding your body and empowering yourself with knowledge. But first, a quick and crucial disclaimer. The information shared in this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for any health concerns or before making any decisions related to your health.
So, what exactly is a stroke, and why should women over 50 be particularly vigilant? A stroke occurs when blood flow to a part of the brain is interrupted, either by a clot, ischemic stroke, accounting for 87% of cases, or a ruptured blood vessel, hemorrhagic stroke. Brain cells, deprived of oxygen and nutrients, begin to die within minutes, leading to devastating consequences. Now, let's talk about Eleanor, a vibrant 58-year-old retired teacher who always thought she was doing everything right. She exercised, ate relatively well, but like many women her age, she hadn't fully grasped how her body's changes post-menopause could quietly elevate her stroke risk. Why is this age group more vulnerable? The answer lies in a complex interplay of hormonal shifts and specific risk factors. As women transition through menopause, the dramatic drop in estrogen levels removes a powerful protective shield that estrogen once provided to their cardiovascular system. This hormonal change isn't just about hot flashes, it's a fundamental shift that can lead to increased blood pressure, higher LDL, bad cholesterol, lower HDL, good cholesterol, and a greater tendency for blood clots. A comprehensive 2023 study published in the American Journal of Geriatric Cardiology, spearheaded by Dr. Lena Hansen, followed 4,000 women aged 50-70. It concluded that postmenopausal women with 2 or more unmanaged cardiovascular risk factors, such as hypertension or high cholesterol, faced a 3.5 times higher risk of stroke compared to their premenopausal counterparts. This isn't meant to scare you, but to inform you, to empower you to look deeper than the surface.
Before menopause, estrogen acts like a guardian angel for women's arteries. It helps keep blood vessels flexible, promotes healthy cholesterol levels, and even has anti-inflammatory properties. But once estrogen levels plummet during menopause, this protective effect largely disappears. Think of it like a protective layer suddenly dissolving. What happens then? Arteries can become stiffer, more prone to plaque buildup, a process called atherosclerosis. Your LDL, the bad cholesterol, tends to rise, while HDL, the good cholesterol, might decrease. This creates a far more hospitable environment for blood clots to form, significantly increasing the risk of both heart attack and stroke. Eleanor, for instance, had always had textbook blood pressure readings, but after menopause, she noticed her numbers creeping up, a common phenomenon. This isn't just a minor inconvenience, it's a direct link to increased stroke risk. A landmark 2022 study, published in the Journal of Women's Health and Aging, led by Dr. Evelyn Reed at the National Institutes of Health, meticulously tracked over 3,500 postmenopausal women for a decade. The findings revealed a staggering 40% increase in ischemic stroke incidence among women with uncontrolled hypertension postmenopause compared to those with managed blood pressure. This research underscores the critical importance of monitoring and managing blood pressure, cholesterol, and other cardiovascular markers more diligently after menopause. It's a new phase of life that requires a new level of vigilance.
Beyond the general cardiovascular changes, women also face several unique or more prevalent risk factors for stroke that are often overlooked. Have you considered the long-term impact of pregnancy complications? Conditions like preeclampsia, which is high blood pressure during pregnancy, or gestational diabetes, can significantly increase a woman's risk of stroke much later in life, even decades after childbirth. It's like a silent marker from the past. Then, there are migraines with aura. While migraines affect both sexes, women are 3 times more likely to experience them, and those with aura, visual disturbances, or sensory changes before the headache, have an elevated stroke risk, especially if they also smoke or use oral contraceptives. Autoimmune diseases, such as lupus or rheumatoid arthritis, are also more common in women and can contribute to inflammation and blood clotting, both direct pathways to stroke. Finally, let's briefly touch on oral contraceptives. While modern low-dose pills are much safer, for women over 50 who might have used older formulations or who have other underlying risk factors, there's a historical component to consider that could still influence their vascular health. A 2021 review published in Stroke and Vascular Neurology highlighted that a history of severe preeclampsia increases stroke risk by up to 2-fold in later life, emphasizing the need for lifelong cardiovascular monitoring for these women. These are not isolated issues. They weave together to form a complex risk profile that demands attention. Understanding the risks is the first step, but recognizing the warning signs and taking swift action is paramount. Do you know the signs of a stroke? The classic acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, is vital. However, women often experience more subtle or atypical stroke symptoms, which can lead to delayed diagnosis and treatment. These can include sudden onset of general weakness, fatigue, nausea or vomiting, hiccups, or even altered mental status. Eleanor initially dismissed her sudden severe headache and brief spell of dizziness as just stress or another menopause symptom. This delay is dangerous because time is brain. Every minute counts in a stroke. Early medical intervention can significantly reduce long-term disability. This is why it's crucial to listen to your body and never dismiss unusual or sudden symptoms, especially if they are new or severe. Don't hesitate to seek emergency medical attention. Educate yourself and your loved ones on these symptoms, both classic and atypical.
Now for the good news. While the risks are real, much of your stroke risk is within your control through proactive lifestyle changes and diligent medical management. What can you do right now to safeguard your future? First, dietary interventions. Embrace a heart-healthy eating pattern like the Mediterranean diet or the DASH diet, dietary approaches to stop hypertension. Focus on whole, unprocessed foods, plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Incorporate leafy greens, berries, nuts, seeds, and fatty fish rich in omega-3s. Limit saturated and trans fats, processed sugars, and excessive sodium. Remember Eleanor? After her scare, she completely revamped her diet, focusing on plant-based meals and drastically cutting down on processed foods. Next, physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week, combined with strength training twice a week. This could be brisk walking, swimming, dancing, or yoga. Regular activity strengthens your heart, helps manage weight, and improves blood circulation. Even small changes, like a daily 30-minute walk, can make a huge difference. Stress management is also crucial. Chronic stress elevates blood pressure and inflammation. Explore techniques like mindfulness meditation, deep breathing exercises, yoga, or spending time in nature. Quit smoking and moderate alcohol intake. If you smoke, quitting is the single most impactful step you can take for your cardiovascular health. Limit alcohol to 1 drink per day for women. Finally, managing underlying conditions.
Work closely with your doctor to control hypertension, diabetes, and high cholesterol. Adhere to prescribed medication, attend regular checkups, and don't be afraid to ask questions. A 2024 meta-analysis published in The Lancet Neurology, compiling data from over 100 studies, demonstrated that adhering to a combination of these lifestyle factors could reduce stroke risk by up to 80% in high-risk populations, including postmenopausal women.
Even with the best intentions, it's easy to fall into common traps. So let's discuss some critical mistakes to avoid, and then some advanced tips to truly optimize your stroke prevention strategy. Mistake number 1, ignoring subtle symptoms. As we discussed, women often experience non-classic stroke symptoms. Don't rationalize persistent headaches, sudden fatigue, or unexplained weakness. If something feels off, especially if it's sudden and new, get it checked out immediately. Mistake number 2, self-diagnosing or relying on anecdotal evidence. The internet is a vast resource, but it's no substitute for professional medical advice. What works for one person might be harmful to another, especially when dealing with complex cardiovascular health. Always verify information with your doctor. Mistake number 3, neglecting regular screenings. Blood pressure checks, cholesterol panels, and diabetes screenings are not just routine, they are your early warning system. Many risk factors for stroke are silent, meaning they have no obvious symptoms until a crisis occurs. Regular checkups are non-negotiable. Now, for some advanced tips. Tip 1. Understand your specific risk profile. Go beyond general advice. Discuss your full medical history with your doctor, including pregnancy complications, migraine history, and family history of stroke or heart disease. Your doctor can help you understand your individual risk score. Tip 2. Advocate for yourself with healthcare providers. Don't be afraid to ask questions, seek second opinions, or express your concerns if you feel your symptoms aren't being fully addressed. You are your best health advocate. Tip 3. Build a support system. Share your health goals with family and friends. Having a support network can make it easier to maintain healthy habits and provide crucial assistance in an emergency. Remember, prevention is about consistency and informed choices.
We've covered a lot today, from the unique physiological changes in women over 50 that increase stroke risk, to the often missed warning signs, and most importantly, the powerful proactive steps you can take. Remember, menopause brings specific cardiovascular challenges, and factors like pregnancy history or migraines with aura can add to your individual risk profile. But the message is clear. Knowledge is power, and action is prevention. By understanding your body, adopting a heart-healthy lifestyle, and maintaining open communication with your healthcare provider, you can significantly reduce your risk and live a longer, healthier life.
If you found this information valuable and empowering, please hit the like button, share it with friends and family who could benefit, and make sure you subscribe to CareWise Senior so you don't miss our future videos. We love reading your comments and being part of the CareWise Senior community conversation. What are your thoughts on this topic? Have you or a loved one experienced any of the unique challenges we discussed today? Share your experience and insights in the comments section below. Your story could help someone else.